Aloha everyone, and welcome to the Hawaii Pacific Gerontological Society's February webinar. My name is Mapuana Ta'amu, and I'm one of the board members for HPGS and chairperson for these webinars. I wanted to start by introducing the chat box available to us all. If you toggle around your screen, I think it's on the bottom, there is a chat room where you're able to submit questions or comments throughout this presentation. Questions will be gathered throughout the presentation and answered at the end, if not during the presentation. So please feel free to send in your thoughts, questions, and concerns regarding Medicare. Okay, so if you haven't already, please consider becoming a member of HPGS so that you can stay updated and invited. There are various rates for individuals, organizations, and associates. Here are a few benefits you'll receive with membership. That includes monthly newsletters where members are welcome to submit articles to be published. We offer free monthly webinars, and members are eligible to be a speaker. There's also special invitations to general membership meetings, kupuna-related events, and workshops. And we also offer scholarships to help anyone of any age pursuing education in the field of gerontology. For more information, visit www.hpgs.org. Okay, so to become a member, head over to hpgs.org, and in the top right corner, you'll see the memberships tab. Click on the tab and you'll be directed to this web page. You're going to scroll down and you'll find more information about our membership benefits. At the bottom, you'll see a button that says to fill out our membership form. Click that button and you'll be redirected to our form. So fill out your information, then click submit at the bottom. And following this webinar, it will be uploaded and archived to our website at hpgs.org. So from the homepage again, hit the webinar tab in the top right, and you'll be redirected to our currently offered upcoming and past webinars. This Medicare webinar will be added to our website no later than 1 week after today. So please feel free to share this webinar with your family or your friends. All right, so let's get down to business. We have gathered here today to talk about Medicare and the penalties you could incur with Parts A and B. Thank you to those of you who have submitted personal questions that you have about Medicare. We will get to those towards the end of the webinar. If you do have other questions, please do use the chat box to type in your question or comment throughout the presentation at any time. I'm sure many of you are either enrolled in Medicare, will be aging into Medicare, or possibly a caregiver of someone who might be receiving Medicare. Today, I've invited a special guest with expertise in the field to educate us about the penalties of Parts A and B that may be unbeknownst to us. She'll also go over other things that Medicare is related to. So if you have questions about Medicare Advantage, maybe Part D, just submit them in the chat box. If you can't find the chat box, you can send me an email at hpgsmembers@gmail.com. All right, so our speaker today is the lovely Margaret Wong. She was born in Hong Kong and her family moved to Hawaii in 1959. She attended Hawaii Baptist Academy and majored in travel industry management at the University of Hawaii. She was the regional director of operations and general manager for several large corporate and incentive travel companies. She left the travel industry in 1993 to specialize in the group health insurance and the worksite market. Margaret was the executive director for the Hawaii Association of Nurserymen. She served on the board of directors and chaired the membership committee for the Building Industry Association. She is a current member of the Honolulu Executives Association and Aloha Society of Association Executives. In 2006, Margaret entered the Medicare market, and in 2010, she joined the Copeland Insurance Group USA to open the Hawaii operation as their Hawaii sales and marketing director. She is currently an authorized licensed sales representative for Humana, United Healthcare, and WellCare Medicare Advantage health plans, also including Medicare supplement plans for AARP or UHC, Humana and New Era, Medicare prescription drug plans for Aetna, Humana, SilverScript, and United Healthcare. Margaret, thank you for being here today.
Thank you for allowing me to come to share some information about Medicare. Medicare is one of those things that people know about, but very few people understand how it works. And that's what we're going to try to do, is to simplify how Medicare works, all the different parts, and also some of the penalties that people are not aware of. So we're going to get started right now. Okay, so what is Medicare? Medicare is a federal health insurance program for people 65 and older, or for certain people that are younger than 65 that qualifies for Medicare, including those that receive Social Security disability income and those who have permanent kidney disease failure. Because Medicare is health insurance, you share costs of your care.
Yeah.
Medicare Part A is your inpatient hospital services. In 2019, your Medicare Part A has a deductible of $1,364 per benefit period. And what that means is that before Medicare pays any of your hospital claim, you do have to pay that first deductible of $1,364 for that when you start at the beginning of the year. Your Medicare Part B is your outpatient services, your medical insurance. And in Part B, deductible in 2019 is $185 at the beginning of the year. So again, when you go to a doctor or lab at the beginning of the year, there is a $185 deductible that you will have to pay before original Medicare pays their 80%. Then there's Medicare Advantage Part C. And these Part C plans are Medicare Part A and B, original Medicare combined, and sometimes include Part D prescription drugs, coverage that is administered by private insurance company. And then the Part D are your prescription drug coverages. In 2019, Medicare monthly premium, most people pay for the Part B base premium of $135.50 every single month. However, if your modified adjusted gross income, as reported in your IRS tax return 2 years prior, is above a certain amount, you will pay a higher amount. And we have this chart that you can reference. So basically, everyone that's making less than $85,000 filing singly, or $170,000 filing as a couple, the base rate that everyone pays is $135.50 per person. However, if your income is much higher, it will go up to the maximum of $500,000 and above for single, or $750,000 as a couple. This is a new category for 2019, which is capped at $460.50 per person per month. So this is something you need to be aware of, and this will be based on your adjusted gross tax return 2 years prior. So for 2019, they're going to be looking at your 2017 adjusted gross tax return that you filed with Social Security. What is Medicare Part A? Medicare Part A helps cover inpatient care for hospitals. This includes critical hospital and skilled nursing facility, not custodial or long-term care. Please keep that in mind, because a lot of people think that Medicare will cover long-term care, home care, or custodial care. Medicare will not. It will also help cover hospice care and some home health care. You must have certain conditions to qualify for these benefits. The Medicare Part A annual deductible in 2019 is $1,364 per benefit period. The Part A deductible benefit shares the cost for the first 60 days of Medicare covered inpatient hospital care on a benefit period. The daily coinsurance amount will be $341 for day 61 to day 90th for inpatient hospitalization, and $682 for lifetime reserve dates. So these are what original Medicare will cover, and then you will cover the balance. If you're not automatically enrolled into Medicare Part A, how can I sign up? If you're not automatically enrolled in Part A during your initial enrollment period, your coverage will start 6 months back from the date that you apply for Medicare or Social Security benefits, but no later than the first month you were eligible for Medicare. Remember, in most cases, if you don't sign up for Part A, if you have to buy it, that is, and Part B, when you're first eligible, you may have a late enrollment penalty. You can sign up for Part A and or Part B during 7-month period that begins 3 months before the month of your 65th birthday, the month of your birthday, and 3 months after your birthday when you turn 65. So this is your initial enrollment period. It is very important that you do keep this in mind so that you will avoid any type of penalties. For your Medicare Part A premium costs, Medicare beneficiaries usually do not pay for the monthly premium for Medicare Part A if you've worked 40 quarters or 10 years throughout your lifetime. Because through payroll deduction, monies are taken out of your payroll to pay towards your Medicare Part A. So if you work the 40 quarters to 10 year, there is no cost for Part A. However, if you are an immigrant or you did not work the 40 quarters, individuals with 30 to 39 quarters of coverage may buy into Medicare Part A at $240 a month in 2019. Those with less than 30 quarters of coverage may pay the full premium of $437 per person per month. So these are your costs for your Medicare Part A premium. What is Medicare Part B? Medicare Part B is your medical insurance. Your Part B helps cover medically necessary doctor services, outpatient care, home health care, durable medical equipment, and other medical services. The Part B will cover 80% of covered charges after the individual meets their yearly annual deductible. It also pays for other medical services and supplies for inpatient stay that is not covered by Medicare Part A. Part B also covers many preventative services. Medicare Part B costs. Depending on your income, you will pay a monthly premium based on your adjusted gross tax return, and I'll show that to you in a minute. The base monthly premium for Part B in 2019 is $135.50 per person per month. You will have a Part B deductible of $185 per year at the beginning of the year. What that means is that in January, when the new plans start, you will have to pay the first $185 of your cost for office or whatever cost of your care. And once the deductible is satisfied, then the plan will cover 20%. If you do not sign up for Medicare Part B when you're first eligible, you may have to pay a late enrollment penalty. What is the Part B late enrollment penalty? This is something people may not be always aware of. If you don't sign up for Part B when you're first eligible, you may have to pay this late enrollment penalty as long as you have Medicare Part B, which is pretty much for life. Your monthly premium for Part B may go up 10% for each full 12-month period that you do not have Part B if you didn't sign up for it. Usually, you don't pay a late enrollment penalty if you meet certain conditions that allow you to sign up for Part B during special enrollment period, which we'll cover later. Okay. What is Part B late enrollment penalty for the individual marketplace? There are many of us that are not working, we retire, we're now turning 65, but we are covered on the Affordable Care Act individual market. It's very important that people understand that if you're in the individual marketplace plans, that you have to sign up for Medicare Part A and B when you turn 65. If you have coverage in the individual marketplace, not through an employer, you may want to end your marketplace coverage and enroll in Medicare during your initial enrollment period to avoid the risks of the delay for future Medicare coverage and the possibility of a Medicare late enrollment penalty. After the initial enrollment period, you can enroll in Medicare Part B only during the Medicare general enrollment period. Let me review again. The initial enrollment period is when you are turning 65, 3 months before your birthday, the month of your birthday, and 3 months after your birthday. If you do not sign up at that time, then the only time you'd be able to sign up for your Medicare Part B will be during the general enrollment period, which is from January 1st to March 31st the following year, to be effective July of the following year. So this will then create a late enrollment penalty for you and your family. So this is something you need to be very aware of. Once you're considered eligible for Part A, you won't qualify for help paying your marketplace plan premium, tax credits, or other savings. So if you have questions regarding this or in this situation, please give us a call. We'll be more than happy to help you. You may have to pay back any of this subsidies or extra helps in your individual medical plan when you file your taxes. So this is something to, again, be aware of. What is late enrollment penalty for employer paid retiree plans or union plans? These are for people that are part of a union group or a employer paid retiree plan. If you or your spouse or family member, if you're disabled, is still working and you have health coverage through your employer or union plan, contact your benefit administrator and find out how your coverage works with Medicare. We don't want any gaps in coverage or anything to affect your union or group retiree plan. If you're covered by an employer or union plan and you are not working, you and your spouse should enroll in Medicare Part B in your initial enrollment period. This is very important because if you do not, and you enroll in Part B if you don't do it at that initial enrollment period, then you can only enroll into Medicare Part B during the general enrollment period, again, which is January through March, the following year, and the coverage won't start until July next year. I know this sounds very confusing, but these are the rules that Medicare has, and we want you to be aware of it or to check with us so that we can explain it to you in more detail. With this gap in coverage, again, will create a late enrollment penalty. So this is something that we want to avoid if at all possible. For those that are in the military with TRICARE or VA, we want you to understand that if you have TRICARE, which is health insurance for active duty service members and their families, you generally must enroll in Part A and Medicare Part B when you're first eligible to keep your Medicare TRICARE, to keep your TRICARE coverage. However, if you're an active duty service member or an active duty family member, you don't have to enroll in Part B to keep your TRICARE coverage because you are actively servicing. So these are the impacts of how Medicare works with TRICARE or with VA. And again, if you have more questions, give us a call. We'll customize the answer based on your specific needs and how it's going to impact you. What is Medicare Part C? I know there's a lot of alphabets, and what Medicare Part C is referred to as Medicare Health Plans, Medicare Plus Choice, or Medicare Advantage Plans. Medicare Advantage Plans are health plan options that are approved by Medicare, but are administered by private insurance companies. Medicare Advantage Plans are required to provide the same coverage as original Medicare Part A hospital and Medicare Part B outpatient services and cover medically necessary services anywhere throughout the country.
Margaret, I just wanted to interrupt you real quick. We have a few people in the chat box.
Okay.
Some people emailed me their questions, and so I typed them out here. Again, my name is Mapuana. So let's see. MW asks, can you explain what the donut hole is? Kathy's asking, what does Medicare Advantage cover? Glenda is asking, she says, I'm a caregiver for my mother and I'm visiting her financial paperwork. Is Medicare Part D required? So I just wanted to let you know what questions you have on the table.
Thank you very much, Mapuana. We're going to be covering this in the next couple of slides. So if you can bear with me, I just want to try to do it a step at a time because if we jump around, it can be very confusing. So let me go ahead and explain how Medicare Advantage Plan works because these are, once you have original Medicare Part A, which is inpatient hospital, and your Medicare Part B, which are your outpatient services, you have original Medicare. Once you have A and B, you can apply for Medicare Advantage Part C. And this is what we're covering now. So what Medicare Advantage Part C does, it offers plans that may offer extra benefits that are not covered by original Medicare. Some plans have added value. Such things include like dental, vision, health club membership, and many Medicare Advantage plan also includes Part D, which are your drug coverage. So many monthly premium for Medicare Advantage plans are generally lower than those of Medicare Supplement Plan insurance policy, which we'll cover later. In turn, enrollees must pay co-payments for Medicare cover services. So again, to recap, Medicare Advantage plans are plans that are going to be as good as original Medicare, but will offer additional benefits that are not covered by original Medicare. Okay? So, okay, we just covered that. So let's see. What is Medicare Part C? There are co-payments according to the plan and the services provided by each of the Medicare Advantage plan options. Here in Hawaii, there are about 17 different Medicare Advantage plan options that have networks. What this means is that you may have to see doctors who belong to the plan or go to certain hospitals that participate to a specific plan. So if your plan does not have a network, you may be responsible for higher co-payment costs if your provider do not accept that particular plan. It is recommended that you contact your healthcare provider to ensure that they accept the Medicare Advantage plan that you're considering enrolling. If you need assistance, we usually look up your doctors and your medication prior to your meeting with us so that we can do the research to find out which of the plans that will cover the doctors and the medication that you want in your different Medicare Advantage plan options. What is Medicare Part D? Medicare Part D is your prescription drug coverage. Enrollment in Part D is optional. However, if you decide not to enroll when you're first eligible, there may be a penalty of 1% of the national base average premium times the number of full months that you are not covered with your Part D drug coverage when you become first eligible when you turn 65 or coming off of a group medical plan. However, if you have prescription drug coverage that is at least as good as what Medicare offers, or what they call credible coverage, you may not need to enroll into the Medicare Part D drug coverage, such as if you're on a group medical plan, a retiree plan, a VA, and TRICARE does provide credible coverage drug plan as part of their benefits. Not all drug plans may cover your specific combination of prescription, so it is important that you compare your options and formulary or list of drugs to be covered by each of the plans carefully. Because if it's not covered, it can be very, very expensive. If you join a Medicare prescription drug plan, you're usually required to pay a monthly premium. However, if your modified adjusted gross income as reported in your IRS tax return 2 years prior to the year that you are eligible is above a certain amount, you will be charged an income-related monthly adjustment by Social Security. This is an extra charge added to your premium because you're on a higher income level. If you're on the base rate of $85,000 as a single or $170,000 as a couple, there is no IRMAA surcharge. This surcharge only applies to those that are higher income-related monthly income. You pay your Part D IRMAA directly to Medicare, not to your plan or to your employer. You are required to pay this Part D IRMAA surcharge even if your employer or third party, like a teacher's union or retiree plan, pays for your Part D plan. If you don't pay the Part D IRMAA surcharge billed to you by Social Security, you could get disenrolled. You may also lose your retirement coverage. You may not be able to get it back. So again, if you have questions regarding this, please let us know. What is Medicare Part D? These are plans that also include a gap in coverage, otherwise known as the donut hole. I know we had a question about that earlier. And what the donut hole is, and it's something that is part of the Part D plan when it was first initiated in 2006. In 2019, the coverage gap begins after you and your drug plan together has a total cost, retail cost of the drug that totals $3,820. And this is based on the retail cost of the drugs. Once you enter the coverage gap, which Medicare will track for you on your behalf, you pay no more than 25% of the plan's costs for the covered brand name drugs and 37% of the cost of covered generic drugs. Once you spend $5,100 out-of-pocket co-payments for the cost of your drugs in 2019, you will be out of the coverage gap and you will be automatically into the catastrophic level. And you will pay a much smaller co-payment for the covered drugs for the rest of the year. If you work with us, we will actually look this up for you so you know exactly if or when you will hit the donut hole and when and how much it will cost you when you reach that donut hole. It's a lot of moving parts, and that's why we help you customize your planning, because depending on the different companies, the cost of the drugs could vary. And what our job is to try to make sure that you find a plan at the lowest cost to you that will cover the medications and the doctors that you need. Part D, late enrollment penalty. Again, like everything else, if you don't sign up at the appropriate time, there are penalties that will be assessed to you by Medicare. You may owe a late enrollment penalty if you go without a Medicare drug plan, Part D, or without a Medicare Advantage plan, Part C, that includes Part D, which is your drug coverage, all inclusive in the Medicare Advantage plan, or other health plan option that includes Medicare prescription drug coverage, or without what they call credible prescription drug coverage for a continuous period of 63 days or more from the initial enrollment period. What that means is that when you turn 65, you need to apply for your Medicare Part D within 63 days, or you will not be able to sign up for your Part D until, again, the following annual enrollment period. And the penalty will be initiated of 1% per month of the national average. Granted, it's only about 34 cents, but it does add up every single month that you're not covered by a prescription drug plan, either through a Medicare Advantage plan that's included or a standalone drug plan that you'll pay extra money for. In general, you have to pay this penalty as long as you have Medicare drug plan. The cost of the late enrollment penalty depends on how long you went without Part D or without credible drug coverage. So therefore, when you're retiring from a group medical plan, we want to make sure that we transition you from your group medical coverage into Medicare before the 63 days so that you will have a Medicare Advantage plan or Medicare drug plan and avoid this late enrollment penalty for your Part D drug coverage. Okay, we're going to transition into extra help or low income subsidy. These are for individuals or people that are on lower income. You may be eligible for help to pay for your prescription drugs. A lot of people don't know that. Some people on Medicare with limited resources and income may be able to get extra help to cover the costs of your monthly premium, your annual deductible, and your prescription drug co-payments related to your prescription drug plan. And here we have is a chart that shows how you may qualify for this extra help. So you may qualify if your monthly income is less than $1,638 as an individual, with total assets less than $14,390. Married couple will be $2,290 with assets of $20,720 annual assets. So we can help you apply for Medicare extra help. what they call low income subsidy. So this is something we want to help people understand to see whether you qualify. Because if we can help save you some money on the cost of your medication, that could be very expensive. We want you to make sure that you have the opportunity to do so. And these are 2019 guidelines. Medicare and Medicaid. A lot of people are confused about the two different plans. Medicaid is basically welfare for people that are very limited income and resources and will get help paying for their premium and their out-of-pocket medical expenses through Medicaid. We do not have the 2019 Medicare eligibility standards, but these are the 2018 based on the federal poverty level. So as an individual, if your monthly income is less than $1,184 as an individual with asset limit of $7,560, or a couple of $1,598 with asset of $11,340, you will qualify or may qualify for Medicaid. We can help you research whether you do qualify for this, because you do have to file with the state and they will validate your eligibility and have you see if you qualify for these benefits. Enrolling into Medicare. I know we cover a lot about how Medicare works, but how do you enroll? We talked about your initial enrollment period, which is the best time to enroll into Medicare Part A during the time that you become first eligible to apply for Medicare, which is 3 months before your birthday, the month of your birthday, and 3 months after your birthday, your 65th birthday. So at this time, you'll automatically be qualified to apply for your Medicare Part A and your Medicare Part B. You do have to call Social Security or go online to socialsecurity.gov to apply for your Medicare Part A and B. It doesn't just automatically come to you. So you do have to remember to contact us to help you or contact Social Security. If you do not sign up during the initial enrollment period, every year between October 15th to December 7th is your annual enrollment period. During this time, you have 53 days to make a change or keep the plan that you have for the following year. For a lot of our members, we review the changes in their doctors, the medications, and there's health issues to find a Medicare plan during this open enrollment period or annual enrollment period that they can make a change or stay wherever they are. So it is important that if you want to have this annual review at no cost and no obligation, to give us a call. The effective date of the annual enrollment period after you sign up between October 15 to December 7th will begin January of the following year. At this time, you can make changes or stay in the plan that you currently have. So this is the next very important enrollment period that you need to be aware of. The general enrollment period is for those that did not sign up with Medicare when you become first eligible. So if you didn't sign up when you turn 65 or when you're coming off of your group medical plan with your employer, then you can only sign up for your Medicare Part A and B during January 1st to March 31st the following year to be effective the following July. So there's going to be several months that you will have no coverage or you have to go and pay for individual coverage that will be pretty expensive. So it's important to contact us about your initial enrollment coverage so that you can avoid this penalty. We also have several special enrollment periods. There's a whole list of them. We're not going to go through all of the special enrollment period, but if you can sign up for Part B without paying a penalty, anytime you have credible coverage based on your current employment. So this is the most common special enrollment period, meaning that if you're working and you're covered by your employer with your group medical and drug coverage, you do not have to apply for Medicare Part A or B. It's good to apply for A because there's some costs for Part A. So you might as well apply for A since it will cover the first 80% of your inpatient hospital after your group medical coverage. Because your employer coverage, your outpatient services, if you don't go to the doctor very often, you do not need to apply for Part B unless your company has under 20 employees. So if you're still working and you're confused as to whether you need to apply for Part A or B, give us a call. We'll help you with that. Once your employment or your employer coverage ends, you have 8 months to sign up for Part B without a penalty. Another special enrollment period is if a carrier exits a plan. So if a carrier that currently have a plan in Hawaii, but they're no longer going to offer that plan for the following year, will trigger a special enrollment period for you to be able to go into another Medicare Advantage plan, or if you want to go into a Medicare supplement plan, you have the ability to do so as long as we have a letter from your current carrier to say that they're no longer offering that particular plan. By having this letter of an exiting of a plan will give you a guarantee issue for a Medicare supplement plan, which we'll cover in a minute. What that means is that you will have no health questions to answer. So these are some of the very common special enrollments that can avoid having any type of penalty that we want you to be aware of. The last area that we want to cover is Medicare supplement plan insurance. Medicare supplement insurance policy is a health insurance sold by insurance company that fills the gap where Medicare Part A and B do not cover. That's why some people call it Medigap insurance. While Medicare pays most of your healthcare costs, Medicare supplement policy helps pays your share of the coinsurance, copayment, deductible, and costs of Medicare covered services that is not covered under original Medicare. The best time to enroll into a Medicare supplement plan is during your open enrollment period. This again is like your initial enrollment period, which begins 6 months before the day that you turn 65 or older and applying for Part B. Or within 63 days, if you terminate from your group health insurance coverage with your employer and are an eligible person as defined by the termination notice you receive from your prior insurer or by your group medical coverage. So this is, again, a very important time period to consider a Medicare supplement plan. Depending on the plan, the individual incurs little or no out-of-pocket costs after Medicare, and the Medicare supplement pays the healthcare provider. Companies can only sell a modernized Medicare supplement policy. The term modernized means that each particular Medicare supplement plan offers the same benefits, no matter what company or which company sells that particular plan. So if a plan F with one company will be the same exact benefit as another company, the only difference will be the cost of the policy and sometimes some additional services. Again, what is Medicare supplement insurance? Generally, the only difference between Medicare supplement policies would be the costs and the options for each carriers. The premium cost or monthly premium for Medicare supplement varies according to the company, plan, and consumer's age at the time of the enrollment and when they apply for Part B. Please note that the Medicare supplement alphabets A to N is different for your Medicare A to D. So again, more alphabets. But what Medicare supplement does is that if you are able to sign up for a Medicare supplement plan when you become first eligible or coming off of a group medical plan, if you do it within 63 days, there are no health underwriting or health questions. So what it means is that you'll have guarantee issue, meaning no matter what type of health issues you have, if you're within this open enrollment period and guarantee issue period, you are qualified to sign up for a Medicare supplement plan. And once you're qualified for life. So it gives you that peace of mind that whatever plan that you signed up for, original Medicare will pay first, 80% of any and all Medicare covers services anywhere in the U.S. as long as you go to a doctor or facility that accepts Medicare. So it just gives you that real peace of mind to know that you will have that guaranteed coverage. Your premium, however, will go up, and it will vary between carrier to carrier. But at least you know that you have the peace of mind that once you're in with a supplement plan, they can never take you off, unless, of course, you don't pay for your Medicare Part B, or unless you are not, you don't pay your premium. So it's very important that we take care of this. Also, with the Medicare supplement plan, you do have to sign up for a prescription drug plan, because if you do not have a Part D drug coverage, remember we talked about a Part D penalty of 1% per month. So the cost of a supplement plan is a little bit higher because your premiums are going to be higher, and it will go up every year because of your age. Plus, you will have a separate Part D drug coverage that you need to pay for. But the drug coverage we can customize based on your specific drugs and type of medication so that we can, again, make sure that you have the coverage that you need at the lowest cost. And that's what we do for you. I know we've covered a lot of information. So if there's any questions, if I did not answer some of the questions that you had, please let me know, and I'll go into it a little bit more detail. But I thought I covered about the TRICARE coverage. If you turn 65 or your VA and you're not actively working, you do have to have Medicare Part A and pay for Part B to qualify for your TRICARE or your VA. Any other questions that I missed?
Let me check the chat box. Yes, we do.
Okay,
Awesome.
great.
So someone is asking, an elderly lady sold her home and reported capital gains.
Yes.
Her Medicare Part B was increased dramatically due to his spike in income.
Yes.
Will her Part B cost go back down to $135 per month next year?
Well, again, as I said, the way the Part B premium works is that Social Security will always look back 2 years. So in 2019, they'll look at your 2017. So if you have a capital gain because you sold a house, then when January 2019, your Part B income goes up. But in 2020, January, if there's no major increase in your capital gain or sales, then your income will go back down to the $85,000, $170,000. So you could go down dramatically. So this is set up by Social Security, and the chart that we have, we can provide you so you know exactly what that Part B premium will cost you. I know it can be kind of scary when it jumps up like that, but again, hopefully because you've had that capital gain, you're able to afford that slightly higher Part B premium. But that's something that Social Security manages and looks at, and the chart we can provide you so you know exactly what category you will be billed according to Social Security standards. Hope that answers your questions.
Great. We got 2 more questions.
Okay.
Do you need to also sign up for Part B even though you are currently employed and covered by your employer's plan?
No. If you have an employer coverage that your employer is paying for your group medical plan because you're working 20 hours, 4 consecutive weeks, and qualify for group medical, you may want to do Part A only because it doesn't cost anything, so that your group medical plan will cover the first 80% of your hospital, and your Medicare will cover the balance. Your Part B, if you don't want to have to pay the $135.50 because you hardly go to the doctor, then wait until you're actually retired to do Part B. There are some rules that if your employer group is under 20, where Medicare is primary, then that gets a little bit more complicated. So when in doubt, give us a call. We'll explain it to you and let you know how to make the best decision as to whether you want to do Part B or not, because we don't want you to pay for something you don't need.
Great. So once again, if anybody has more questions, please use the chat box. I believe it's at the bottom of your screen. Just move your cursor around and there should be a little icon of like a little chat bubble. Good, I see more questions coming in. Another question is, when you are finally terminated from your employer's coverage, Do you have to also enroll in Part B, even though you intend to enroll in an Advantage plan?
Yes, what we try to recommend is for people, when you're ready to retire, give us a call 3 months before. That way, whatever the last day of your group medical coverage by your employer ends, we'll have your Medicare, for the Medicare Advantage or supplement or whichever plan that you're looking at already in place. We don't want you to be coming to me and say, okay, Margaret, I'm retiring next week because my plan ends. You still have to apply for Part B. So we don't want you to have to either go to Cobra or have to pay out of pocket. So it's better to plan ahead of time before your actual retirement date so that everything is already set up ahead of time. We looked up your doctors, we looked up your medications. We'll help you enroll in a Medicare Advantage plan or whatever options you're looking for so that there'll be a smooth transition. This way, it'll be a lot less stressful for you and for your family, and you know that you'll have coverage in Medicare when your employer plan ends.
All right. And one more question. Do you charge a fee for your review?
Thank you for that question. No, absolutely not. What we are is to be your resource. We do not charge. There's no obligation to call us. We're here to service you because Medicare is so confusing. We're all getting to an age where this is very confusing. It changes every year. So give us a call anytime. We'll help you. If you want us to give us the opportunity to be your resource, we'll help you do the enrollment. We'll take care of everything for you. And throughout the year, you can give us a call for any questions, and we'll be able to be there for you. And we do annual reviews because all of these plans change every year. So we want to be able to help you decide the following year whether what you have is fine or you need to make a change. So again, absolutely no cost, absolutely no obligation.
Great. Well, I'm going to readjust the camera so you can see both of us. Okay, so if anybody else has any more questions, just go ahead and type it in the chat box. If you do email me at hpgsmembers@gmail.com, I can forward the information to Margaret and she'll get in contact with you if you have any questions further down the road. Otherwise, thank you, Margaret. This was a great webinar.
Thank you very much for the opportunity.
Yeah, I know I look kind of young, kind of am. So I'm not the Medicare age, but you know, it's really good to have this information in my back pocket. I work with seniors as well. So if they have questions about Medicare or even just small talk, talking about Medicare, the donut hole, I know what that is. And you know, I can really impress other people. So if you are interested, have your children, if they're in the healthcare field, watch our webinars as well.
Yes.
It's free, open to the public.
Yes.
And this webinar will also be, it's recording right now, so it'll be posted to our website at hpgs.org in approximately a week. So I'll email the membership when that is all said and done so that you have this available and ready to send to your friends and family.
Thank you so much for this opportunity.
Yeah, so Margaret, if you have any last words for our audience.
Well, we'd love to be your resource, and we'll be able to answer whatever questions. We don't know the answer. We're going to find out together. So thank you very much.
Cool. I wanted to pull up really quick our flyer. Okay, so otherwise, please do check out our website at hpgs.org. If you have any questions on membership, I'm also the membership chair as well as this webinar chairperson. So send me an email at hpgsmembers@gmail.com. And let's see, otherwise, thank you, Margaret.
Thank you.
I wanted to give a little shout out to our next month's webinar, which will be in March 28th. I believe it's always on the last Thursday of every month. And our feature speaker will be Coco Mao, who will talk about advanced care planning. So same time, 11:30 a.m. to 12:45. This flyer has not been sent out yet, but shortly it will be. So if you are not a member yet, please do sign up so you can receive our newsletters. This will be included, and it's always sent out to our membership and free for the public. So once again, please send it to your friends and family. You know, we want to get the conversation started about Medicare, about advanced care planning. And also let me know if you have any future topics you'd like to be discussed, because we're here for you folks. So other than that, if there are no other questions, which I believe it's finished for now. Oh, no, there are more questions, I think. Nope, we're good. Okay, I guess that's it for now.
Thank you.
Thank you so much, Margaret. And thank you folks for tuning in to HPGS. Look out for our webinars for next month. Okay, bye.
Bye-bye.